Okay, now we're going to talk about how to start a peripheral IV. One of the important things when you're assessing the patient's site or the arms to see where to place it is the placement of the tourniquet. You want to make sure the tourniquet is no more than 6 inches away from the area that you are evaluating. What that does is maximize the amount of blood that is kind of held there to maximize the ability for you to palpate and to see the vein well. You want to only put the tourniquet on tight enough to obstruct the flow of the veins at the surface. So if you've ever had lab drawn at a station somewhere and someone put the tourniquet on so tight it felt like your arm was going to fall off, that's not something that you need to do. The patient should not be in pain. It should be a comfortable but a snug fit. Again, you're trying to obstruct the flow of blood on the surface of the arm. You want to avoid places when you're doing home care. You know, the patients are extremely mobile, so they're trying to fit infusion into their daily lives. So we usually try to stay away from the placing an IV in the hand and in the bend of the arm. The reason we stay away from the elbow area or the AC area is because if it were to infiltrate, you're not able to see that as quickly because there's that cavity there over that joint that the fluid would be pocketing in. The patient would have some discomfort but wouldn't necessarily see the area swell. You don't want to tear tape and put it on anything dirty. From an infection prevention standpoint, that's extremely important. You don't want to put anything dirty near the site, and that's going to stay there for 72 hours. I'll show you a small technique that I like to use, but the main point, whatever technique you use, just make sure that you're not putting something dirty around the hub, near the site at all. If a patient's having trouble, if you're having trouble getting a patient's veins to show themselves, one of the things that can be used is a warm compress. A warm, heat always dilates and plumps it up, where cold constricts. So applying a warm compress to a vein if you're having trouble visualizing the entire tract. One of the things you need to consider is the length of your catheter. And your catheter will have the gauge and the length on it. So this is a 1-inch catheter. So if I see a vein that I'm going to say I'm going to use, the insertion point, the point at which I break the skin, and I'm going to thread that catheter into the vein, I need to have a 1-inch area where I can kind of see and feel that I know I'm going to be able to thread that through. If you're going to insert the peripheral catheter into an area that just beyond it there's a valve, you'll see a little bump. If there's a valve there, you could have trouble threading through that valve. So that's just some of the things that you look for whenever you're going to choose a site to insert into. You want to make sure you have the length of the catheter of either you can feel the vein or you can see the vein track, that you'll be able to thread it and you won't have any trouble there. So let's go over some of the supplies. We have, of course, our catheter that we actually send out the B. Braun brand, an IV start kit, an extension set that has the microclave attached, clean gloves. The clean gloves are here in case you have a patient that already has an IV and you're needing to remove the old IV. And we have some saline and 10 unit per ml heparin, which is normally the what you would use in a peripheral catheter. So let's open up our IV start kit, since our patient, our little pad, little training pad, does not have a catheter yet. So I talked a little bit about what I do with the tape. So if I think I'm going to need tape, one of the things I do is I tear off a piece and put it in this clean area right here, which is actually sterile as we begin, but my touching it will make it not sterile. So I just put a couple of pieces on there. My tourniquet, again, if you have a tourniquet that is not new, that's not sterile, you can't use it in between patients from an infection prevention perspective. You can't use it in between patients without properly cleaning it to make sure that you're not taking germs from one patient to the other. So this tourniquet is in of course, the kit. We're going to put on our gloves. Again, starting a peripheral IV is a sterile, clean procedure. There's some things that will remain sterile and some things that will remain clean. So once I put on my gloves, I'm not expecting it to stay sterile the entire time. If I wanted to pre-prime my my extension set, then I could do so. This is sterile inside this container right now. If I were to pull this out without touching any of this, then I don't have to use alcohol. If in doubt, grab an alcohol pad and vigorously clean the end. I can prime my set without having to remove the end cap, the protective cap, but just by letting a drop out. Alright, so that's ready for me to use. I can open up my IV catheter, just like the other skills that I showed you, one of my techniques. I'm sure you all have little tricks of the trades as well. To prevent anything from flying out is I hold it like that. And then it is ready. Putting on my gloves is the same procedure as sterile gloves. It has the cuffs. You can use the cuffs to pull it on. Put your fingers in like that. And pull it on like that. Again, this part is fine. I'm going to remove this out of your area. You can use the alcohol pad that's included to clean the area, one of the things I like to do with patients is use the alcohol pads as I wipe toward the patient. It helps that bluish vein stand out a little more, especially when I'm trying to make sure that I have enough track there to stick and thread. We provide you with the chlorhexidine little cleaning tool here that is activated when you snap it. So this is encased like this. You want to snap and then squeeze. Then you vigorously wipe the area that you're going to be sticking and you allow it to dry. While that's drying, I'll get my Tegaderm ready and my catheter. When you're pulling out the catheter out of the little container, of course, all your supplies, before you open them up, you want to inspect them, make sure the expiration date is good, that they're not damaged in any way. You want to kind of hold onto the catheter and pull straight out. Sometimes if you just pull on the clear part, the blue part in the catheter will stay encased, and you don't want to ever re-enter into the catheter part. So you pull it straight out. This is discarded. Now, with the barred catheter, which is a safety catheter that's built in, it's passive. This little piece right here allows you to thread with one finger. I'm still a two-finger kind of a girl with the thread procedure, so you'll see me change that up a little bit. but that is there for that reason. You want to make sure when you go to insert the peripheral that the bevel is up and that this little piece there is up. So if I had my patient, I would secure their arm in a way that would make the vein taut. I would insert, and as soon as I felt it go in, I would stop. I always encourage my students to kind of take a breath here, lower the catheter, and you want to thread in just a little bit more, and then as you pull the needle out, it threads in, and you can hold pressure here. You can see the safety device has engaged. I take my piece here, and let me turn it around like this, and then I apply that extension set. While that sits there, I can then reach over and apply my Tegaderm. And remember that it's very important for you to put the date, your initials, and information on this little piece right here, which I would, while I'm doing this, put aside to write on after I'm done. And then I would remove and put on the site. Flushing your catheter with saline, getting a flashback, all of that is important. You want to make sure that you're inside the vein. And that is how you would start a peripheral IV.